And my name is Stephanie Russo. I'm one of the archivists in Dublin City Library and Archive. And I'm delighted to be welcoming you all to this, our 34th City Hall Lunchtime lecture series. And it is our first online, so it's a first in that regard. And it's great to be able to welcome so many extra people along. And I suppose just before we get started, I just wanted to remind everyone that we do have, after today, we've got 3 more lectures happening on each Tuesday in April at the same time. And at the moment, we do have spaces available at all of those lectures, and you can book a spot on Eventbrite like you will have done for this one. This one did sell out, so if you would like to join us for any of the upcoming lectures, I would advise you to book early. We've got Dr. Brendan Kelly, Professor Brendan Kelly, joining us next week to talk about the history of psychiatric hospitals in Dublin. And then the following week, on the 20th, we have Susanna Reardon, who'll be talking to us about venereal disease in early 20th century Dublin. And then finally, on the 27th of April, we'll be joined by Dr. Simon Egan to talk about the Black Death in Dublin. So a really exciting lineup of things to come. Today, if you would like to ask any questions of Dr. Milne, it'd be great if you could put them in the Q&A box. For people just saying hi and letting us know where they are, you can use the chat box for that, but it's just a little bit easier to, I suppose, to work through all the questions if they stay in the Q&A boxes. So today I am delighted to welcome Dr. Ida Milne, who's going to be speaking to us about the Spanish flu in Dublin. Dr. Milne is a historian of epidemic disease. She's a European history lecturer at Carlow College, and she's a visiting research fellow at Trinity College's Department of History. She's also a member of the Royal Irish Academy Historical Sciences Committee. And her monograph, which is called Stacking the Coffins, Influenza, War and Revolution in Ireland, 1918 to 1919, was published in 2018. And she's also a frequent commentator on Irish and international media on the historic comparisons for COVID-19. So we really are in great hands, and I'm delighted now to hand over to Dr. Milne.
Thank you very much, Stephanie, for the lovely introduction there. And I'm just trying to share my screen here. And very welcome to all my friends in the audience from across America and Scotland, and to all of you who are just becoming friends as we're listening here today. And I'm really delighted with this chance to talk about my obsession, and something that I've worked on since 2005, and which I did for my PhD in Trinity, and which even as recently as maybe 5 years ago, I was told I really should widen my horizons, because Irish history was about a lot more than disease. And I said in answer to that, well, the kind of disease I do really encompasses all of society. And I think people have begun to realize that now a little more effectively. I'm just checking, Stephanie, before I begin, that you can see my screen there. Yeah, okay. So the picture you see there in the background, the image is actually a gram-negative image of the 1918 flu virus, which I took for the Centers for Disease Control in America's website. If anybody is interested, they have a very good set of research on the global impacts of the 1918 flu. The flu emerged first as a mystery malady, which came out towards the end of the First World War. It was really long heralded, as wars almost always brought back diseases into the civilian population, things like smallpox, typhus, etc., and of course STDs. Journalists in papers right around the world and here in the Dublin newspapers and the provincial newspapers in Ireland warned that great diseases always follow great wars. So when this mystery disease that turned some of the dead black, it had echoes of the plague, turned up first in the northeast of the country and in a quadrant from Antrim down as far as Dublin. In the early summer of 1918, few were really surprised, but it did take people a while to agree that it was actually a flu because, of course, it was appearing out of season. Flu typically appeared in winter, and one which we now know is the largest killing influenza pandemic on record since the 1500s, ranked as one of the biggest killing diseases alongside the plagues of Justinian of the 500s and the Black Death in the Middle Ages. It paralyzed societies and economies around the world as it swept through its still trade. And it, there's things actually coming up over my screen. I can't stop them at the moment. And just go back one step. It brought a formidable enemy right into people's homes, even as many were suffering from the impacts of the First World War, and also with Ireland's connections and issues in the revolutionary period. It spread really, really rapidly around the world. Most countries had 3 waves. It filled people with fear because it kept coming back over and over again. There was no cure, and it really confounded medical knowledge. Doctors were puzzled. They had new confidence in the ability of bacteriology, the new science, to bring down deaths, the levels of death from infectious disease, which were huge. And here was a disease, a virus, which, but they didn't yet know it was a virus. Flu wouldn't be isolated as a virus until the 1930s. It had both common characteristics as well as unique local features wherever it occurred. And these unique local features often caused increased death. And I think we see that now too. Water shortage or cuts or fuel shortages, overcrowded housing, power supply issues, sewage, conditions of poverty, and environmental issues like smog would also. I'm just wondering, Stephanie, my screen sharing seems to have paused, it's telling me.
Yeah, we're still on the mysterious malady slide here. Is that what?
Let me go back again and stop share because it just, I'm so sorry about this.
Don't worry.
You can see now?
Yeah, now it's moving. Now it's moving.
Right. So it had many, many echoes with it has many echoes with the COVID-19 crisis. It's a different but similar illness in that it spreads, through coughing and sneezing and things like that. The global spread, the social impact, the medical puzzle, the political reaction, like what do we do here? The overwhelming of health systems and the large numbers of ill and of dead. And too, there was a long 1918 flu, like long COVID, that affected people for many, many years afterwards. But this is something that I'm told by medicine is very common with all influenzas. It's just the huge numbers infected now. All influenzas and other similar infectious diseases, it's huge numbers infected now makes it more remarkable. It's not over yet, so we don't know yet whether the scale of death, illness, and ongoing damage to human bodies will compare. And thanks to the better conditions than we have in 1918 and the fact that it's probably not 1918 flu for all of how bad it was. It's not. I don't think that it's going to kill as many people thanks to the measures that we've taken. But in the US, COVID-19 deaths are now at about 560,000, very little short of the 1918-1919 total of 670,000. There is, of course, a much bigger US population now than there was in 1918-19. I'm part of a group alongside my colleague, Dr. Patricia Marsh, in Ulster, who works in the picture in Ulster. Her book will be coming out soon. I'm part of an international network of historians, historical demographers, science writers, geographers who've been trying to raise awareness of the risks posed by pandemics on the scale of the 1918 flu. Amongst the public and with medical and government interests. And the centenary anniversary had really provided what turned out to be a timely focus to raise awareness. We knew, and we were told by our science colleagues, that another pandemic was just a matter of time. And indeed, the same thing is true even now. People like Dr. Mike Ryan of the WHO would warn that the next pandemic is just a matter of time. Pandemics do a peculiar thing. They cast a very sharp light on society, exposing existing issues. And I think we're all aware in our own communities, regardless of where they are, that these issues have emerged again, the cracks, if you like, in society. And one thing I would like to urge is that health history shouldn't be a niche subject. It's important that we all know these kind of issues, that we know what can happen even at family level, as well as at the level of political management of countries or at medicine or whatever else is important. It's called Spanish flu because Spain was not involved in the First World War, so it wasn't affected by wartime censorship. So the newspapers there had no hold back on covering the flu itself. But by the time it infected Alfonso XIII, here on the right-hand side, the 31-year-old Spanish king, it had already weakened the French, the US, the British, and the German armies. Each side didn't want the other side to know where it was infecting, particularly in the arenas of war. So censorship was taking this information out of the newspapers. If anybody wants to read more about the impact on the war, the wonderful South African historian of the flu, Howard Phillips, has written about it on its impact on the war on the 1914 to 1918 Encyclopedia of World War I. The locus of origin is still debated, despite claims that it began in Fort Riley in Kansas in the spring of 1918. We as an international community can see that it started earlier, but definitely once the American army got involved in coming to and from the arenas of war, it spread much more widely and much more quickly. It's quite clear that war conditions helped it spread, including here in Dublin, whereas soldiers would come home for a bit of rest and relaxation between their fighting in the war. They often travelled around Dublin, and indeed we have some accounts of that happening, where soldiers would, be so anxious to get some entertainment while they were home that even though they had the beginnings of the flu, they wouldn't stay home until it got too bad. So they would obviously have been contaminating people as they travelled around. In terms of global statistics, Edwin Oak Jordan gave the first 1920s estimate in the 1920s that about 20 million out of a global population of 2 billion died from it. Now the World Health Organization say that 40 to 50 million died, but some estimates are hovering closer to 100 million. And indeed, in recent months, the Indian death estimate has gone up yet again to 20 million. The real toll had never been known. Death certification was in general in its infancy, and in many countries was patchy. You can imagine how difficult it would be to collect firm numbers in Russia during revolution, or in the countries that were devastated by the war. Death certification by disease had been introduced in Ireland since the 1860s. And like many other countries, we use the ICD system of classification of death by disease, then the 1911 version, and that's still in use today. To compare and give something of the scale, the other two pandemics, flu pandemics of the 20th century in 1957 and 1968, I remember it so vividly, catching it as an 8-year-old, and the very vivid dreams that I got with it. Those pandemics killed between 1 and 2 million each. The estimates vary, and they made really very little impact on the death in Ireland. Indeed, when I look at it, you see the death from flu actually goes down during those years rather than rising. The statistics from Ireland and from Dublin, according to the Registrar General, there are 20,057 certified flu deaths. And Patricia and I have looked at those and we can see them concentrated into 3 waves, which I'll show you in a minute. I have added in about 3,000 excess pneumonia deaths to bring up the total maybe to about 23,000. And I know Patricia's done some further work estimating, that adding in excess deaths from other diseases, which she'll be revealing when her book is published. I'm estimating that about 800 to 900,000 caught the flu, or more than 1/5 of the population, which is about 4 million at the time, if the case fatality rate was 2.5%. Dr. Anthony Kinsella helped me with this estimate. But there's a lot of reason to realize that many deaths weren't certified as people were dying so fast. Doctors focused on keeping the ill living rather than on trying to counter or do the paperwork for the dying. Leinster and Ulster were the provinces most severely affected. Kildare had the highest county death rate. Dublin and Donegal were also very severely affected, and indeed Dublin suffered very severely in all 3 waves, as did Donegal. Dublin in 1911 had a population of 477,000 people. The Registrar General listed the certified flu deaths in 1918 at almost 1,800, and in 1919 at almost 1,100 deaths. Anthony and I have estimated that Dublin infections would be about 24% of the population. In places with lower populations, it was about 1/5, but in places with in more urban areas, it went up to about 1/4 of the population. As it moved through the townships and the suburbs of Dublin, entire areas would go quiet. Howth was then a very important shipping location, not so much now, it's more of a fishing port now and a leisure port. But at that stage, the ferries across to Britain would go from Howth. Kingstown, also a very important port, or Dún Laoghaire as we know it now, were amongst the early regions of Dublin city infected, along with other port towns along the east coast like Belfast and Dundalk. Commerce, as it moved through regions, would be quietened. Shops struggled to stay open, partly because of the lack of footfall, and this is documented well in the newspapers, and also partly because shop workers were particularly vulnerable to the flu because they were forward-facing. They were in the line of fire dealing with the public. Schools, libraries, and other public buildings were closed to try and curtail the spread. Children were understood to be super spreaders, so it was considered really important to close schools. Matches and concerts were postponed, court sittings were suspended. In Dublin and in some other cities in Ireland and smaller towns as well, the city streets were sprayed with disinfectant. The cinema owners pleaded that they would go out of business in Dublin if they didn't, if they weren't allowed to stay open. Cinemas, of course, were also an important source of news at the time because the newsreels were telling about what was going on in the war and other issues. So they were permitted to stay open, provided they left a 15-minute gap between sittings to let in fresh air and to disinfect. They'd go around with a thing called a deodar, which was a kind of a pump that they sprayed disinfectant into the cities with. This also happened in private buildings as well. This is a newspaper from the 26th of October, 1918. Newspapers at the time were tiny because newsprint was in short supply because of the war. So there were typically about 6 pages in the Independent at that stage. So when a story was there, it was a big story. And when flu would travel through a community, it would knock the war off the front pages, or at least down to lower down the news order. So this story tells a virulent epidemic were the worst for several generations, talking about the scarcity of doctors, And of course, many doctors and nurses were away at the war, so there was a huge shortage at the time, just when the system needed more at home. Church prayers ordered. And then there's the demand for release of interned men, because some doctors who had been interned because of their anti-conscription campaigning, they would have been members of Sinn Féin, and they had been interned from May 1918 onwards under the German plot affair. The two diagrams I'm going to show you now show you flu deaths in 1918. First of all, the darker colours are the colours with the higher rates of flu. And you can see that in 1918, when the first and second waves occur, that most of the impact is along the east coast, from Donegal on the west coast, but right down around here in the periphery, down to Wexford and over into parts of Waterford and Munster. But that the west is largely unaffected. And if you watch now as it changed to 1919, you'll see that it moves broadly westwards in 1919 in the third wave. But again, Dublin is badly affected and Donegal is badly affected, as it is in all three waves too. This diagram shows Spanish flu and pneumonia deaths in Dublin in January 1918 through to June 1919. It shows three distinct waves. The first one comes in late May to mid-July, and you can see it's quite small. The second wave, the worst one in Dublin, is between October and December 1918, that one in the middle. And the third one begins to come in at the end of January until April 1918. In the middle of April, the numbers just drop suddenly and don't rise again substantially, even though there are deaths, of course, in between the waves, but there's nothing that makes a serious impact in terms of numbers. The two lines there, the blue one is influenza and the green one is pneumonia, because of course many people might recover from the flu but might then die from a subsequent bacterial pneumonia infection. This is just to show you some of the Evening Herald headlines between October 1918 and spring of 1919, like influenza epidemic in Dublin, the influenza scourge, influenza spreading, and then that reference at the bottom is that 18 million young men have died from the flu globally, was an estimate that was given at the time. And then you see this constant kind of dialogue that goes through the flu about public health management, about new vaccines that are coming out, and all sorts of things like that. This is the Irish Times, just one day's paper there, 31st of October 1918, which is really at the peak of the second wave in Dublin. And it's talking, you know, many of the issues that were going on that were important at the time, about abatement in the coastal towns, you know, in Kingstown, but that they keep saying, trying to persuade people to calm down, I think, that the flu is abating, and then the next day they'll say it's risen again. And I think, you know, there was a lot of work, and again, this was something we saw in the current pandemic. You'd see headlines saying that the fear and the panic is almost as dangerous as the disease. Some of the headlines that you see now could have come straight out of 1918. So they talked there on the right-hand side about the effects in legal circles and how many members of the bar had become ill. And the atmosphere within the shipping offices along the north and south walls was yesterday distinctly suggestive of the wards of the hospital. So out in the port, Dublin port, minus its patients, and the Jay's fluid was sprinkling on the floors. Walls and ceilings had been sprayed with disinfecting mixture. Candles had been lighted in the dark and in cupboards, disinfectant candles. Then Charles Cameron there, who was the Chief Medical Officer of Health for Dublin, hugely influential person at the time, 88 years old, still working. And he said that the epidemic was now at its height and that it was beginning to abate. And again, his request there that the cinema houses, that they shouldn't let children in under 14 years of age, and the cinemas had listened to them. talk about then and about disinfection and purification being just now housekeepers and managers of all sorts in business and general establishments. And again, this is very reminiscent of what we were all doing, disinfecting our shopping when we came home, washing our hands. It's what we've had for our last year as well. And talk there of good ventilation. And again, somebody like Orla Hegarty, the architect, has been talking a lot about the importance of ventilation. Then work at the hospitals. On the left-hand side there, you see that the intern and medical nursing staffs are having a particularly busy time. All the general hospitals, the prevailing illness has incapacitated a goodly proportion of doctors and nurses. And the approximate number of persons treated in all Dublin hospitals for flu and pneumonia is put at 1,500. And this was the same in towns right around Ireland during those weeks. You see, even New Ross had a very small port town, had 1,000 people under medical care, not all in hospitals, and Dundalk had, I think, 3,000 sick that week, again under medical care. And you see down in that report, they say also in most of them, the staff, doctors and nurses have been inoculated with the antitoxin vaccine. So there were vaccines being made, but these particular vaccines were made from what they understood flu to be caused from at the time, which was bacteria. So the people were being injected, I think it was, with a mixture of things like Pfeiffer's bacillus, which we now know as HIB or Haemophilus. I won't even try to pronounce that, and Streptococcus and other bacteria like that. I understand from colleagues who I work with in science, like Dr. Anne Moore and Dr. Kim Roberts, that these would have done nothing to prevent flu, but that they might have prevented a secondary bacterial infection with something like HIB. So therefore they might have saved lives. There are lots of stories of people becoming disoriented when the flu happens. So Dublin City Coroner's reports, for example, which the late Gregory O'Connor, I'm very sorry to hear he died recently, he pointed me towards them, of the National Archives. He told me to look at these coroner's reports, and in them I found things like people collapsing on the tramways and being run over by the tram because they were so out of it with the flu, or being hit by carriages as well. There was one story in the Evening Herald which I found particularly poignant, was of a man who drowned in Herbert Park on the south side of Dublin. When he fell into it, suffering with the flu, he'd gone out to get medicine for himself and his wife and drowned in the park, which anybody who knows Herbert Park will know the pond is about, at best, a foot deep. So you'd really have to be really not very well to drown in something that shallow. Who were the most vulnerable to catching the flu and dying for it? Well, age, occupation of the family income earner, and class, including, of course, the conditions of poverty, were the principal factors contributing to catching the flu and dying from it. Statistics and newspaper reports show us that death from flu is much more likely in families where the breadwinner dealt with the public. So you get shop workers, police, doctors, nurses, postal workers, ambulance service, newspaper people, prison warders, priests were all likely to die. Domestic service was quite protected, and I think this was because they actually had very little time off and therefore very little time to go out in the public. The very poor then, a lot of the people who shared their stories with me have told about their family, maybe the man in the family being dependent on casual labour and therefore feeling obliged to go out and work even when they weren't well. They wouldn't have savings. So housing conditions, money for food, heat and medicine were all a factor in making them more vulnerable, that they would feel obliged to go out and earn. And then in those days, of course, there was no COVID dole, and health insurance was really, for workers, was really very, very limited. Tenement living, of course, made it much more difficult, because if you were in a tenement and you were already first of all, it's really overcrowded. You'd have shared toilets. You probably wouldn't have a running tap in your tenement building. It was quite often outside, not even in your tenement room. And then there were issues like slates missing off roofs, cracks in the walls, and panes of glass missing. So this meant that the smog also placed an added burden on flu sufferers. This diagram gives death in Dublin by social class and occupation in June 1918 to June 1919. The Registrar General categorised class into four. The first one was the upper class, which would include people like senior bankers, senior members of the army, and of course, you know, prominent business people or big business and major landowners and things like that. The second class, the grey one there, that's the pale blue one down at the bottom there that you see. The second class was the middle class, which is the grey category there, quite a big group as well. The third one was artisan and petty shopkeepers. So you have people like craft workers and small shop owners in that one. And then the fourth category the Registrar General used was the working class, which is a huge class, the biggest in terms of numbers, but also it included people like that perhaps we wouldn't include in working class today, people like prison warders, policemen, postal workers are all in there, as well as people whose employment was rather less secure, you know, piece workers and street hawkers and things like that. And what this category shows really is that flu affected all, death from flu affected all four categories. But some more than others. Obviously, the poorer you were and the worse conditions you were, the more cramped you were, it was really more of an issue. And what I found fascinating about this, well, first of all, you can see that there's some error with the statistics there, which means I think that the first wave is a little bit missing. But then the second and the third wave are very marked across all categories. But if you look, and I wish I had oh yeah, maybe this will work as the pointer here. Frank Ludlow, who's a historical geographer in Trinity, pointed this out to me. He said, look, the upper class people are taking some kind of preventive measure here and here, because less people are dying at that stage in those categories. He said they've copped on what's happening and they're not going out themselves. And indeed, this is correlates with the newspaper reports. The Irish Times had the story from November 1918, where Westmoreland Street grocer right in the city centre said the better class of people are sending out for their messages just now. But it says nothing about the poor devil who actually went out for the messages, whether they were more likely to catch it or not. This flu hit an unusual cohort of people, very unlike COVID. It hit people, it was more likely to kill rather than older people. It was more likely to kill young, strong, previously healthy adults. And there is a lot of theory on why this happened. And some people even say it might be precisely because they do have a strong immune system and might have been more vulnerable to something called cytokine storms, which again, we hear of happening now. So the 20 to 35-year-olds, which are also the age category that are the category often of parents of young children, were the age group that were hit. Older people are understood maybe to have some protection from it, from an earlier similar flu that they might have come across before. Then the other group that's hugely tragic, and every time I think of it, it just saddens my heart, was the under fives. And you can see here on the left-hand side, the under fives were very, very vulnerable to it. As they were to all infectious disease at the time. Typically in the Ireland of the 1920s, there were 70,000 deaths, 1910s, there were 70,000 deaths on the island a year, and 20% of those were children under the age of 5, which is just unimaginable with our contemporary health picture. This is just a snapshot of death from all causes in Dublin in the week ending the 2nd of November 1918. Altogether, the 562 deaths, and 502 of the 562 could probably be attributed to the pandemic. So again, you see very clearly here that 25 to 35-year-olds are really, really vulnerable, and the under fives. I think there was 98 under fives died that week. You know, how it must have caused quite a lot of drama in the Dublin at the time. This is from the Registrar General's death certification lists, and it lists some of those who died in Dublin around that week. I was trying to pick out one or two. Here, third from the top, you see Alfred Keane, a bachelor, 20 years old, a student, influenza 8 days, pneumonia 5 days, very typical of the kind of report of the time. I cannot read his address. And then I saw another one down here, Christina Ryan, a printer, unmarried spinster, 27 years of age. And again, she died from flu around that week as well. She was from Blessington Street in Dublin. 70% of the Irish population got their healthcare from the Poor Law medical dispensary system, which is managed locally by the Local Government Board for Ireland, which had its seat in the Customs House. And then it was managed centrally by them and locally by the individual Poor Law unions. There was usually one in each market town. It was a very fractious relationship by then. The boards of guardians had become largely nationalist in composition, and this caused tensions between the Local Government Board and them, which was very evident during the pandemic. The Local Government Board were constantly quibbling about costs. Does this sound familiar? And even giving out about the amount of money that the local doctors were spending on things like whiskey, which was one of the few things that could actually give relief at the time. No grand plan came from the Local Government Board for Ireland to deal with the pandemic. This is also true of the Local Government Board for England and Wales and for Scotland. So it's maybe something to do with the way the system is organised rather than anything really anti-Irish, I think. The Poor Law dispensary system was overwhelmed. South Dublin Union Hospital, which is now St James's, hired all the nurses they could and cleared most non-flu patients out of the infirmary and the workhouse and hired someone to take the bodies to the morgue. Doctors worked around the clock. Dr. Rafferty and Bray told of treating 300 patients in 74 households in a day in October 1918. Stunning. Doctor after doctor fell ill. Replacement locums had to be found. All the hospital records that are still extant, there's a real problem with the survival of hospital records from the time, talk about ward after ward being given over to flu patients and of the measures they were doing to it. D.W. McNamara wrote of working in the matter as a junior doctor and how scary it was, you know, to see patients just literally disappearing out of beds into the morgue, and every time you looked there was a new patient that was there. And doctors were worrying they were doing something wrong, and the only comfort they had in the matter was that they could hear the constant plod from the other city hospitals on the way to the cemetery at Glasnevin. So at least they were no different. City pharmacies opened late in the evenings and made huge quantities of cough medicines. They talk about making them in Jeroboams, which is a great big container, and closing late at night, maybe 9 or 10 o'clock, and then continuing to make medicines with second sets of staff and delivering those, sometimes with the aid of the army around the city. But doctors threw everything in their bag at it, but had no effective medicine. At an emergency meeting of the Royal Academy of Medicine in Ireland in November 1918, doctors pooled these suggestions: something for sleeplessness, some preparation of opium. For headache, they gave aspirin. In America, the rumor went around that Bayer, the German company which made the aspirin, had actually infected it with the flu. For fever, they gave quinine. To keep the bowels open, they gave calomel, which is actually mercurous chloride. My argument about that is that I think doctors did that to try and persuade patients, very sick patients who were too sick to get out of bed, that they were improving, because if they suddenly got out of bed to go and sit in the pot, it might have been that they thought they were feeling better. Alcohol was given in copious quantities, but those areas where alcohol was objected to for religious regions, doctors felt obliged to give things like an injection of strychnine. And strychnine, of course, for those of us of my generation, is something that James Bond's assassin was quite fond of using. rather than being a medicine to improve people. Doctors agreed that vaccines made from several different types of bacteria weren't convincing. So really this disease punctured medicine's confidence in bacteriology, which they thought of as the wonder kind, because it was making a huge impact using bacteriological methods with very clean hospitals and open fresh air, was helping to reduce the levels of death. This guy is Sir Charles Cameron. I know somebody in the audience has a particular fondness for him, as I think most of us who work in the history of public health do. He was Dublin Medical Officer of Health at the time. He'd been working to improve the health of Dubliners for 50 years. The city death rate from infectious disease had fallen from 9 per thousand living in 1879 to just over 1 per thousand living in 1917, but it still lagged behind other equivalent-sized cities in Ireland and Britain. His dream was that each Dublin family would have their own toilet and a tap. And I suppose we've almost realised that. His advice was frequently sought by journalists, and this was that people should go to bed and stay there until well better, as many people died from pneumonia following flu. And he said that good nursing with plenty of liquids offered the best chance of survival, and that people should stay home to watch contagion. And it's a really clear, simple messaging, and something that I was writing about early on last year, because the local government board themselves issued a really complicated notice that was so complicated that hardly any of the newspapers bar the Irish Times carried it. And, you know, when you're sick, you need to be able to follow clear, simple directions, not to have to try and see what the hell they mean in this. This is an image of Dr. Kathleen Lynn, the medical doctor and Sinn Féin activist. She dodged arrest during the German plot roundup of anti-conscription activists in May 1918. And when the flu broke out in Dublin, the Lord Mayor, Alderman O'Neill, persuaded her to give herself up, to come off the run on condition that she worked with the flu ill, which she was doing anyway. And she set up a temporary flu nursing home for flu at Charlemont Street, and vaccinated said thousands in the inner city. The nursing home was only open sporadically during the flu, but later became St. Ultim's Hospital. And again, this vaccination may have saved people from getting secondary pneumonias. So the most important role, I suppose, the pandemic played was in the lives of the individual patient and in families who suffered loss or permanent disability of loved ones. Flu changed lives. We tend to think of it as a once-off crisis, but it changed lives in the long term as well as the trauma of the immediate illness. Many people not only suffered bereavement, but a double loss with the loss of their family home, if an income was lost, or if the house came with a job. Sometimes if both parents died, families were split up and went to, and this happened in the case of my own family, where two cousins of my grandfather were 13 and 14. One went to family in Dublin and the other stayed with family in Enniscorthy. It's a long and interesting story, but not for today. But for some people, life was just never the same. So just let me quickly introduce you to some Dublin flu people, because I want to leave some time for you to share your own stories. And I have to say, first of all, I've done about 50 interviews or more now, really, but 50 directly with people who would have lived through the time, and then some with the families of people who lost people and the impact, talking about the impact on their families. And now I get, when I'm doing talks around the country, I get lots of people come and share stories, which I'm really delighted have been triggered to a certain extent by the improved access to the death certification, which is now online, and is a great source for me and other historians. So I'm really grateful to the people who share these intimate and tragic family experiences, that trust me with them. Very much so. This is Catherine Moran, who was the wife of Charles Heatley. He had died at the Battle of the Somme, leaving her in 1916, leaving her to raise 3 sons. She died from influenza pneumonia in November 1918 with her little sons at her bedside. They never knew what she died from or where she was buried. Her grandson, Fred Heatley, a great friend of mine, told me their story, and Fred found her grave in Glasnevin Cemetery, and we've been to it. And it's lovely that it gave, I think it's fair to say that Fred took a lot of comfort from being able to find it and discovered that indeed it was quite close to some of the other family plots as well. Elizabeth Malloy from Lucan told me of her family's survival. She was, I think, 97 when I interviewed her. And she remembered it being so afraid in October 1918 when she was, I think, a 9-year-old girl, and being sort of semi-febrile, not quite conscious, but knowing that her parents and all her siblings were much worse than she was, and the fire had gone out, there was no food in the house. And she remembered hearing the ching of spurs, as she described it, and knowing that that was her uncle who was in the cavalry coming home from the war. She called him a horse soldier. And he swept her up and put her into bed properly and helped her get warm. And when she came to again, he had lit the fire and was dosing them all with whiskey and had made stew and was helping to feed them and really saved all their lives. This one, perhaps I was going to tell a few more stories, but I think we've run out of time. Stella Larkin McConnon, she's James Larkin's granddaughter and has been a great friend to me. I began interviewing about the impact of the 1913 lockout on her family, but she told me of her mother's family, the Moores, from a tenement at 34 Marlborough Street. Anna Moore was the third of 10 children, her mother. She was born in 1909, and she was the only one of those 10 children to survive beyond the age of 5, which shows you how different the times were, and particularly for the families of the poor. And civil registration in Glasnevin cemetery records enabled me to find that 4 of the Moore children died from infectious disease between 1911 and 1918, things like infant diarrhea and measles. In November 1918, Stella told me that little Mary Moore, her aunt, who was then 4, said to her mother, "Mommy, could you dress me in my best dress, please? I feel something important is about to happen." And she did that, and she climbed into the one bed in the family one-room tenement and died from the flu. And Stella's testimony made me much more aware of the kind of syndemic disease environment in Ireland at the time, pandemic, and one of the reasons maybe why we didn't see it as a thing. Why it wasn't so much that it was forgotten, but that it was buried amongst all the other deaths from disease that were going on at the time. And this is the kind of room that Stella's family would have lived in at the time. 21,000 Dublin city families lived in these one-room tenements, no running water, no toilet. The basin there would have been for washing as well as preparing food. There's actually 5 children in that picture. Most of them are in the one family bed. And our modern family eyes can't begin to imagine how hard it was to nurse flu sufferers in these conditions without the kind of taps that we have access to at the moment. You can see little Mary Moore's death there, 4 years of age, child of a labourer. She's certified to bronchitis, which again shows the issues with trying to see just how many died, because sometimes a doctor could certify it to something else. And then just one maybe other, this is James Delaney, who's the grandfather of a friend of mine, Anne Burke. He was a very typical victim, a young adult, aged 25 to 35, working with the public. He worked for Dublin Metropolitan Police as a constable and was stationed at Lad Lane and lived near Kimmage Cross and died. He felt obliged to go back to work. He survived the flu in December, but he felt obliged to go back to work because so many of his colleagues were down ill, and they were also struggling to try and manage the flu and help the community in Dublin at the time. So his wife had to go out and become the income earner as a result of his death. So it's very typical of what happened. And there's his little family after his death. And death by disease was to impact in that family once more. That little girl, Beck, on the right-hand side, died from scarlet fever 2 years later. So just quickly to please consider keeping your COVID stories or contributing to an archive to enable future historians. Those of us work in 1918, we had to scrabble everywhere to try and find bits of material. So collecting oral histories will be important to the COVID-19 history to consider contributing to something like the DCU COVID-19 Oral History Project, or if you're a medical worker, to the Royal College of Physicians Heritage Archive COVID-19. These individual stories are really important, and we know how it is now. We see that now. Individual stories are so important. to telling this story. It's more than about statistics or about what happened in hospitals or about politics. It's about us, about the individuals as well. So I'll just leave it there, and hopefully I haven't gone over too much, and I look forward to your questions.
Thank you very much, Dr. Milne. That was really interesting. And I think we can all agree that there's a lot there that's very relatable in a way that it maybe wouldn't have been a couple of years ago.
Yeah.
We do have a good few questions coming in for you, which I'll get to in just a minute. I just want to hop on there what you were saying about COVID archives. We do have one here in Dublin City Library and Archive. So if anyone has anything...
I'm so sorry for not mentioning that.
Oh, that's okay. Don't worry, don't worry. But if anyone has anything, I suppose, related to Dublin or they're in Dublin, we would be delighted to take any submissions that you have. And then there's a couple of questions popped up about accessing this talk again. So you'll probably notice it has been recorded and we'll be making it available on probably the Dublin City Library and Archives blog and hopefully also on our YouTube account. So I'll get on to the questions because, as I said, there's a good few of them. The first one was somebody saying that their grandparents, when they were alive, used to talk about the Easter Rising and the Great War, but very little mention of the Spanish flu that killed so many. And he's wondering if you have any ideas why it might be.
Yeah, I put forward a few arguments about that. One is that, our history was very much told as political or military history at the time, and really history from below and the history of social life didn't become that much of a mode in history until after the Second World War. When you see all sorts of history really around the world changing the way we look at history. The other argument I would have is that it faded into the background because of that idea that there was so much death from disease at the time. It was part of that overall picture of death from disease rather than an individual event. And finally, I think I would argue that it's very interesting when I go and give talks, and I know Patricia Marsh has this feeling too, is that often we get fed back the material, not fed back, but where people will say, oh, my dad was from Donegal, they had a really bad experience with the flu, or my dad was one of those young, strong, previously healthy adults that it hit. So I think we needed a national flu narrative, this kind of history that Patricia and I and Katrina Foley have done, so that people could hook their own individual family stories onto those stories. And when I began interviewing in 2006, a lot of people would say things like, what was it all about? Like, I remember being sick and I remember the community going still, but I don't know anything outside that. And I know my own dad, who was a local historian in Wexford, said that really people thought it just happened in their own area. He said they were often too sick to go out and buy newspapers at the time. But those people who were aware did read newspapers. Elizabeth Malloy, for example, worked in a newsagent's. Some of the other people I interviewed had a consciousness of it being a bigger story, and they would have been readers who knew about it coming from newspapers as well, I think. So it's a really interesting question. Thank you.
Okay, thank you, Dr. Milne. Another one here. My grand-aunt got infected with the flu in Killarney, and my grand nursed her. My dad was a toddler at the time, and he went on to get Parkinson's disease. We were told that there was evidence of a connection. Can you comment on that?
Yes, indeed. And I know my my in-laws in County Clare, my ex-husband's family, that they had a little girl who was brought to them as a baby when her mother died from Sligo down into the Curry family in Curraclare. And later, many of the children that she was raised with got Parkinson's as adults. I think 3 of them. I'm trying to remember how many now. Even though the incidence of flu in County Clare was quite low. So it may have been she brought flu into that family. But there have been studies done that show that there is a suspected link between Parkinson's or a higher than usual amount of Parkinson's and Spanish flu.
Oh, wow.
So yes, yeah. Huge ongoing impact on your family as well,
Yeah. Okay. And then Maria was asking, why was Donegal so affected? Do we know why that might have been?
Patricia and I, Patricia's particularly looked at the flu, Patricia Marsh in Ulster, and we thought at first it was seasonal labour, because Donegal, of course, had strong connections to Scotland and the sea, and they'd go backwards and forwards in ships and boats, private boats, maybe with loads of family on them. Then, of course, the Donegal, that would spread the flu, for one thing. Then Donegal, of course, has high tradition of wakes. Even now, I think that's been an issue during COVID as well. And then I interviewed Kathleen McMenamin, who was 107 at the time when I was in touch with her in a phone interview and through email facilitated by her daughter as well. And she lived in Rathmullen, which is on Lough Swilly. And she had been 15 at the time of the flu. And she said, look, the reason she thought Donegal was so high was because what she called Jellicoe's army, that the Grand Fleet was actually stationed in Lough Swilly for a lot of the war, or they take shelter there, and that they were coming in and out into the community. So that it was really the Navy and the soldiers on those ships, probably, coming to and from the war, or maybe across to America and back, I'm not sure. That might have spread it in Donegal. So I think it's a complicated and a very interesting picture. So thank you for asking that.
Okay, and another one here, I think we've time for a couple more. What was the fatality rate once you had the Spanish flu? Was there a significant recovery rate, or was it always fatal?
Oh, the vast majority of people survived. It's considered to have infected between a third and a half of the world's population. So in Ireland, the work that Anthony Kinsella and I did, we looked at the numbers of dead and trying to work backwards from that to look through newspaper reports and accounts and see what had kind of infected, what kind of level. And so we estimated at 800 to 900,000, about 1/5 of the population would have caught it. But there's a kind of a global rule of thumb that if there weren't any other challenges within a community, it would kill about 2.5% of those who caught it. But some populations, like the Inuit in Alaska, it might wipe out half the local community because they had other challenges going alongside it.
Okay, brilliant. Thank you. We'll do one more, and then I think we're going to have to leave it. John says it was a fascinating lecture, and there's lots of comments coming in thanking you and saying how great it was. A fascinating lecture and so relevant to today's pandemic. Regarding public hygiene measures, were citizens required to wear masks, social distance, wash hands? Were there any anti-maskers or conspiracy theories?
Lots and lots of conspiracy theories, particularly in relation to, in America, as I say, aspirin and the Germans inserting it into the aspirin boxes. There were suggestions that the typhus vaccine given to the US Army was actually what caused it rather than flu. So anti-vax was there then too. In Ireland, most of the advice would have been about closing buildings. I haven't seen much evidence of masking, but they talk about people having scarves around their faces and everybody being sprinkled with different kinds of disinfectant like eucalyptus or whatever. Charles Cameron and others advised social distancing. Schools like Clongowes, where I've had lucky good records, show that they took measures like separating the sick from the ill, and that the sick would be fed at a different time to the ill, and that they'd cut off communication with the outside world and effectively within the school, so the staff wouldn't have been allowed to go to funerals in the village. Mask wearing was much more common in America, where you'll see a lot of the images and the pictures come from. And America at the time was also very strong on public health management in certain cities, where they'd have kind of hit squads of nurses that would go around. Indeed, we had those here too. In Dundalk, one of the local community groups, there would be food kitchens set up in some parts of the country to feed the very ill. There was one in Naas, there was one in Clonmel, there was one in Dundalk, but in Dundalk they also trained what they called the young girls of the town in rudimentary nursing skills. The nurses, the local Alexandra Guild would train them in nursing skills so that they'd be able to look after their own families better than before. So yeah. lots of local measures. I mean, most people were saved by neighbours and by members of the family who stayed well. And again, the doctors were emphasising that good nursing was really the thing that could save most people.
Okay, super, thank you. There are lots more questions, but unfortunately we don't have time to get to them all. Dr. Milne does have a Twitter account. It's at Milne M. So perhaps she might be kind enough if any of you find her on there and ask her more questions.
Stories.
I'm sure she might. And I'm sure she'd love to hear any stories you have as well. As I said, we couldn't share them all. So I'd like to thank Dr. Milne again for opening our lecture series. And I'd also like to thank my colleague Anne-Marie McInerney, who very kindly co-hosted with me in case of any technical problems. And of course, thank you all for coming along. And I hope maybe we'll see you at some of the other lectures over the coming weeks. So thank you very much, Dr. Milne, and I'm sure we'll see you again soon.
And thank you very much for asking me, and to such a great audience as well.
Yeah, thanks, Ida.
Thank you.
Thank you.